We're going to go ahead and do the neurological assessment, but first we're going to start with a focused cranial nerve exam. Remember that we do not test cranial nerve 1. We're going to start with cranial nerve 2. Remember, ideally, you're going to have a Snellen chart, especially if you're in an outpatient clinic, you're going to use the Snellen chart because that's the only way you can objectively measure visual acuity. It's going to be 20 feet away, and you're going to have the patient cover one eye, test their acuity, and then cover the other eye. So go ahead and just cover one eye, and then they read the chart, cover the other eye, and they read the chart. That's cranial nerve 2. Then we're going to go ahead and do cranial nerve 3. This is my pen light, look at my nose. We're going to shine the pen light into the left eye, look at the left eye's pupil response. Then we're going to shine it again into the left eye and look at the right pupil response. Then we're going to go ahead and switch sides. Right eye looking at the right pupil's response, right eye looking at the left pupil's response. Also remember, cranial nerve 3 controls our lids. Her lids are open, so she doesn't have any lid lag. Then I'm going to do the 6 cardinal fields of gaze. Look at my finger and follow my finger. 1, 2, 3, 4, 5, 6. So that's cranial nerves 3, 4, and 6. Next, we're going to do cranial nerve 5. This is light, and this is sharp. I want you to close your eyes and tell me which one is sharp or dull.
Dull. Dull. Sharp. Dull. Dull. Sharp.
Remember that you want to get all 3 branches of the trigeminal nerve. Next, we're going to do the 7th cranial nerve, and this is to assess our facial symmetry. Go ahead and smile. Puff out your cheeks. Don't let me push them in. Close your eyes really, really tight. Don't let me pull them up. We're going to go ahead and do cranial nerves 9 and 12 at this time too. So I want you to go say ah. I want you to stick out your tongue. Move it from side to side. Put your tongue inside your cheek. And now the other side. Then we're going to go ahead and do cranial nerve 8. She's obviously following my commands. She's also having no speech difficulties, but following my commands, so we know her cranial nerve 8 is intact. But if you want to do something a little bit more specific, you can put your hand over the patient's ear, and you want to have them repeat the word that you say.
Dog. Dog.
Okay, that's cranial nerve 8. We already did cranial nerve 9. Vagus nerve is cranial nerve 10. Spinal accessory. Go ahead and shrug your shoulders, and don't let me push down. Put your cheek on my hand, and down this side. And that's a sternomastoid muscle, which also is innervated by the spinal accessory nerve, cranial nerve 11, and we already did cranial nerve 12. So that's our cranial nerve assessment.